Well, the Hope House, we're in partnership with Niagara County Department of Mental Health, the Mental Health Association in Niagara County. Outside that, we get calls from St. Michael's, Lockport Cares, different hospitals. It
Outpatient
varies.
counselors.
Outpatient counselors, yes, Horizons, and
Dale Association.
Dale Association. It varies.
Sure. So, Rosemary, Director of Peer Services. So, are there a lot of peers that are employed?
There is 3 others.
3 others. Are you looking for more currently, or do you?
I am. Yes.
Probably always, right?
Yes.
Who would make a good peer to work there?
Someone basically that can, relate to people going through whatever they're going through.
So somebody that doesn't mind talking,
Right. Right.
and has a heart for other people, I would
yes.
assume. Right. So has COVID changed that? Are you looking for people more than you used to be, or?
COVID has changed actually. They have to be vaccinated to work at the Hope House.
Yep, and that's something that we run across for community missions. I think we've
Right.
talked about it in some of our other programs as well, as we are a healthcare agency that not only all of our staff need to be vaccinated, but also volunteers
Right.
as well. So we have a lot of community service volunteers that are looking to come in, maybe doing their 10 hours for high school or something like that. And yeah, everybody's got to be vaccinated, so it's just changed a lot of what we can do now. What are some other changes that the pandemic has brought upon Hope House, would you say? You mentioned the drop-ins, certainly, that's different than it used to be.
Oh, and we also used to have AA and NA groups that would be able to utilize the facility to have their meetings. Unfortunately, since COVID, though, we haven't been able to do that because we don't really have that type of space for social distancing and monitoring, unfortunately. But, hopefully as things get better, maybe we'll be able to start offering more services to the community or be more involved in the community and let them know that we are here and this is what we do. It's a building, it's not any signage or anything like that. It just looked like a regular house.
Sure.
So if you're out in the community and you go by, you wouldn't even know what it was. You'll just think it was better than the neighborhood.
Right, sure. And what other changes, anything else you can think of that's made it different now?
I know for the clinicians that come and work with individuals or guests who are staying at Hope House, for a while there we were impacted by COVID and having more telehealth sessions.
Yes.
But since the release of all that, we are doing face-to-face and in-home and back to doing all.
So I was going to ask, so maybe the beginning of the pandemic, did you see more calls into the warm line, or did you notice anything along those lines when people were shut in and cut off from the world?
The calls had dropped off for over a year.
Really?
Yes, which I thought it would have increased more, but with the pandemic going on, a lot of people just had other resources or were busy trying to protect themselves.
Interesting.
Yeah, because we had to change everything suddenly.
Yes, for sure.
It wasn't no warning or anything. We're still trying to recover from that.
Right.
So, but our numbers of calls are increasing. They've gotten much better the past 8 months. So.
Yeah, that's interesting because, certainly we've heard a lot about mental health and how difficult all of it, do I have to read any statistics on that? All of us had a hard time, probably still dealing with it and such. But, having resources like the telehealth and a phone number, you would think, that would have.
Yeah, I thought
higher.
that we would have received more calls.
Yeah,
but,
right.
As long as people were all right, so,
Yeah.
Again, we try to do what we can, and we don't force treatment either. So,
Sure, right.
Just trying to be there for them when they need.
Right. So you mentioned the telehealth. So what happened during the pandemic and what has changed now with looking at those things?
So the licensed clinician would use a telehealth platform that the county uses for their outpatient clinics and all their other
Was that in
clinical
existence
services.
before COVID, or did that roll
No,
out
we
during-
had to roll out
Okay.
quickly because, yeah, here we were. I mean, it was in progress. I don't want to say it, but it was quickly expedited
Sure.
to meet the needs of the community. So, I mean, I didn't supervise the program at that time. So, in terms of the day-to-day, I don't know how much. But again, my clinicians are back to working at Hope House in the community, and I think the clients appreciate that face-to-face.
For sure, I would think. I think that it, I mean, certainly served a purpose and probably does continue to serve a purpose for, certain individuals, but it's just nothing like being with someone, right? As we're seeing all the time in our meetings and,
Makes a difference.
yep,
Seeing
shaking your
their
hand
face.
earlier, right? Yeah, just
Yeah.
have been able to do that for a while. So again, I'm joined by several of the staff of the Hope House, located in Lockport, also known as the Peer Recovery Respite Center on Walnut here in Lockport. Daniel Neal is the Hope House coordinator, works with community missions. Rosemary Marvin is the director of peer services for the Mental Health Association of Niagara County. And Gillian Henry Game is the community-based services supervisor for the Niagara County Department of Mental Health. So we have about 22 different programs that we can kind of tick off for community missions. Certainly, I would want to say this is probably one of, if not the most collaborative, that we have 3 different organizations kind of represented here. So what does that kind of interplay look like? You talked a little bit about it, but just maybe an overview, if you could, Daniel, about the role of each of the 3 organizations.
It was it's been a good ride. It's been very interesting. Working hand in hand with other agencies. We always networked before, but not necessarily in the same building.
Sure.
So it was, I'm still learning a lot about it, the give and take and the different policies, and it's wonderful. It's great. Had somebody told me about it, it's like, well, I don't really see that really working out, but so far it's been really well. I mean, we're able to provide appropriate service, and having individuals with actually lived experience makes a huge difference as well, rather than someone who never had a diagnosis or just know of what they read about mental illness. I mean,
Right.
it puts a different spin on things.
Yep.
I mean, people who work there, I can't say enough good things about them. I mean, they're a wonderful group. They truly care about what they're doing.
Right. And so we should mention specifically Peer Recovery Respite Center, right? That's the lead
Yes.
off of it. So that, by my understanding, and please correct me, that means over half of the staff there are peers themselves that
Correct.
have some kind of a diagnosis of a mental health concern.
Yes,
Right? So
or
they can-
lived experience.
Lived
yes.
experience, right. So that, the people that are on the other end of that warm line specifically know what they're talking about, hopefully, and can kind of walk people through whatever situations that they might be going through.
Yes.
So I think that's probably something that separates this program from other resources maybe out in the community. as
Yeah,
well.
very much so, because you don't have someone talking to you as a clinician, when you call it online. It's
Sure.
actually someone who you may be able to identify with.
Right. I think that is certainly one of the neatest things about the place, and honestly, like a couple of our other programs as well, that you would drive right by it and there's not a big community missions, or whatever, sign in front, but that it blends into the community just as well as it
Yeah,
does.
it makes a huge difference. Before then, we were a psychosocial clubhouse, and we had a sign on the front with a hand holding a globe. And people would say, "So are you guys fortune tellers?" Because it was named Future Visions.
Okay, all right, yeah. In a way, perhaps you were, but
So yeah, seeing all that change, I mean,
Right.
change is the only constant, but
Sure.
it's definitely been a good change.
good. Good. Well, I want to revisit again for some people that maybe have just joined us. We're talking about the Hope House and Peer Recovery Respite Center. Gillian, again, talk a little bit more about, or a little bit once again about who makes sense to be referred into this kind of program, what the referral process looks like.
Any individual that's having a mental health difficulty managing their symptoms, maybe their supports aren't available or their resources aren't available that they usually would access to manage their symptoms. Maybe their coping skills aren't working as well. So having the support of the staff at Hope House is important. And the fact that it feels like a house instead of an institution is a huge benefit.
For sure. Yep. It's a big, right? I don't know how big, but a big 2-story house basically on Walnut.
Very comfortable.
Yes, yeah, for sure. And so 4 beds are there, and that's what you were talking about for the referrals in. But then anybody you had mentioned could call the warm line. And give us the warm line number again.
The warm line is 716-433-6543.
So certainly those are resources that we want you to be aware of out there in the community. If you have somebody in your family or friends or someone out there that you're just thinking about, please feel free to give us a call or to give that warm line over to them, that they may feel comfortable in doing so. But for some people out there that may be able to help us, and we can help them as well in hiring as well. So Rosemary, if you want to mention a little bit, give your best spiel on if a peer might be out there or somebody that you might be looking to hire, who would be the best person for something like that?
Someone that likes, helping people, love, talking,
Yeah,
I suppose.
Talk somebody through a situation.
Yes.
Right. Very good. Gillian, do you want to say?
And I was going to say, you can also call Crisis Services directly
sure.
at 716-285-3515.
All right.
Some referrals come in straight through them as well.
Yep, so Crisis Services is certainly one of those programs that we work in lockstep with, I'm sure, to make sure, just trying to meet the needs of the community, right?
Yes.
And that's certainly the whole point of the program when it was built out, specifically kind of serving alongside Eastern Niagara Hospital, right, to make sure that people are have another alternative rather than the emergency room. And been there for, so how long has Hope House been there on Walnut? Daniel, not to put you on the spot,
I believe
but
this
ballpark.
will be probably the, oh man.
I'm thinking 7 or 8 years.
I was thinking more like 9, probably 8.5 years.
I was going to say, I've been here about 10 or so. I remember a grand opening for early on, I would
Early
say. So
on,
8 to 9 years would be my ballpark, at least, I think.
Like I said, it's been a good ride. It's a wonderful program.
Yeah. Well, thank you all for the work that you do to serve everybody that's out there, but specifically, I think most of it comes from Eastern Niagara County here. But thank you all so much for what you're doing there and for coming out and braving the cameras here at LCTV and talking a little bit more about how you can help the community. So I wanted to give one last pitch to you. We got a few tickets left for our Sweetheart Dinner that's coming up at the end of March. So that's Friday, March 31st. It'll be held at the Sheraton Niagara Falls in downtown Niagara Falls. We'll have about 200 people or so gathered together. Would love for you to be one of them. So thank you so much for watching Community Link. This is Christian Hoffman signing off until next month. Take care.